Hey guys, Dr. D here. Hey, stop it. We're gonna do some puppy therapy today. Actually, we're gonna talk about ibuprofen for children. You might be wondering, Dr. Dana, when do I give ibuprofen to my children? And that is a valid question. Unless you have kidney problems, ibuprofen is a relatively benign drug. Why do we give ibuprofen for fevers and when? This is very important. Our bodies are pretty tightly regulated, right? Like if we get 2 degrees too cool, eventually we're gonna die of hypothermia. And if we get like a few degrees too hot, we're gonna die of hyperthermia. There's not much wiggle room there. What happens when you get a fever, even up to 102, 103 degrees Fahrenheit, is that your body starts to almost evaporate off the fluid in your body at a much higher rate. So not only is your child likely not feeling well, they're not wanting to eat or drink, but they're also losing fluid much quicker than they would normally if they were at a normal body temperature. My general rule of thumb is if they're hanging out like 100 up to maybe 101 and they're comfortable and they look like they're completely unfazed, maybe leave them alone as long as they're drinking fluids and you're noticing that they're having regular urination and the urination is not like a bright yellow color or anything. If they're babies, it's great because you can just check and make sure they're having around the normal amounts of diapers for that specific age. However, if their temperature starts to get up around 101 or greater, that's when I would say start to consider ibuprofen for sure, because you just don't want them to get dehydrated. Though I totally understand if you're that parent that's like, no, I really don't want to give them unnecessary meds, but this is a case where I would say you should probably do it. I personally like to use ibuprofen as my base. I use ibuprofen every 6 hours approximately. If extra pain relief or fever relief is needed, I add in the Tylenol. You might be wondering, why does she do it like that? Because ibuprofen is processed by the kidneys. It's easier to overdose on Tylenol because it's processed by the liver. So add in the Tylenol up to twice a day on top of the ibuprofen only as needed. I use it as my backup because sometimes that ibuprofen just doesn't kick it to bring down the fever or the amount of pain that your child's having. But if those two are the case, you should probably seek attention from a medical doctor just to double check that you're still on the right track. This is not individualized patient medical advice that I'm offering because I, of course, do not know your specific medical background, and there are always exceptions that we make for different types of medical conditions. So please consult with your physician before implementing any of these procedures, and I hope this was helpful. Please comment below for more information, and as always, if you have any questions, you can send them my way, and I will do my best to answer them in a timely fashion. In peace and health, from Love Health and me, Dr. D. Bye!